Phlebotomy last-minute study guide. Question 1. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A, osteosarcoma. Option B, osteomyelitis. Option C, osteoarthritis. Option D, osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 2. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A, gold top, SSD. Option B, light green top, PSD. Option C, lavender top. Option D, light blue top. The correct answer is option A, gold top, SSD. Gold SSD tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 3. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 4. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A, the functional capacity of platelets to adhere to vessel linings. Option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C, the total count of circulating red blood cells per microliter. Option D, the efficiency of the kidney to filter out waste urea molecules. The correct answer is option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 5. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A, standard needle attached to the syringe puncturing the tube top directly. Option B, a syringe transfer device with a shrouded needle. Option C, pouring the blood from the syringe barrel after removing the stopper. Option D, injecting it through a butterfly needle set. The correct answer is option B, a syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 6. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 7. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 8. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SSD. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 9. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves. The correct answer is option C, nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 10. Why is the first drop of blood wiped away during a capillary puncture? Option A, it contains skin surface bacteria. Option B, it contains tissue fluid contamination. Option C, it hemolyzes too rapidly to be accurate. Option D, it clots too quickly to be collected. The correct answer is option B, it contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 11. What is the proper location for a capillary puncture on an infant's foot? Option A, the center of the plantar surface near the arch. Option B, the medial or lateral borders of the plantar surface of the heel. Option C, the tip of the great toe. Option D, the posterior curvature of the heel bone. The correct answer is option B, the medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 12. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 13. Which of the following elements is a key component of quality control in a point-of-care testing? POCT program. Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 14. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A, pink top or glass red top. Option B, gray top. Option C, light blue top. Option D, light green top. The correct answer is option A, pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 15. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 16. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full-body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 17. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A, a 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 18. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 19. What type of communication technique involves nodding, maintaining eye contact, and repeating back statements to ensure clear understanding? Option A, passive communication. Option B, aggressive communication. Option C, active listening. Option D, defensive communication. The correct answer is option C, active listening. Active listening uses eye contact, nodding, attentive posture, and restating information to confirm understanding. It helps patients feel heard and reduces miscommunication during care. Passive, aggressive, or defensive communication does not reliably verify understanding. Question 20. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 21. Which of the following statements is true regarding a multisample needle gauge? Option A 21-gauge needle has a larger opening than a 22-gauge needle. Option B, an 18-gauge needle is smaller than a 23-gauge needle. Option C, the larger the gauge number, the larger the needle lumen. Option D, all needles used in phlebotomy have the same internal diameter. The correct answer is option A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely, the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 22. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A, PAL/white top with gel barrier. Option B, light blue top. Option C, gray top. Option D, yellow top with SPS. The correct answer is option A, PAL/white top with gel barrier. PAL or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 23. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A, prone position. Option B, high Fowler's position. Option C, supine with legs elevated or flat. Option D, standing upright with assistance. The correct answer is option C, supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 24. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 25. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A, BSST, light blue, blood culture. Option B, blood culture, light blue, SST. Option C, light blue, SST, blood culture. Option D, blood culture, SST, light blue. The correct answer is option B, blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 26. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, DDTA. Option C, sodium polyant whole sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 27. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 28. Which of the following tests measures the average blood glucose concentration over the past 2 to 3 months? Option A. Fasting blood sugar, FBS. Option B. Oral glucose tolerance test, OGTT. Option C. Hemoglobin A1c, HbA1c. Option D. Postprandial glucose test. The correct answer is option C. Hemoglobin A1c, HbA1c. Hemoglobin A1c reflects the percentage of hemoglobin that has glucose attached over the lifespan of red blood cells. It estimates average blood glucose over roughly 2 to 3 months. Fasting and postprandial glucose tests measure glucose at a specific point in time. Question 29. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A. Releasing the tourniquet within 1 minute of needle insertion. Option B. Keeping the patient's arm down during the venipuncture procedure. Option C. Allowing the patient to pump their fist repeatedly before and during the draw. Option D. Transporting the specimen to the laboratory within 30 minutes. The correct answer is option C. Allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 30. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A. Informed consent. Option B. Implied consent. Option C. Verbal consent. Option D. Statutory consent. The correct answer is option A. Informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 31. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 32. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A. Full name and room number. Option B. Full name and date of birth. Option C. Attending physician and bed number. Option D. Date of birth and diagnosis. The correct answer is option B. Full name and date of birth. 2 reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 33. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 34. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 35. Which of the following is an example of a vector-borne transmission? Option A. Contracting a cold from an airborne sneeze. Option B. Acquiring a skin infection from a contaminated countertop. Option C. Getting bit by a mosquito infected with West Nile virus. Option D. Drinking water containing bacterial toxins. The correct answer is option C. Getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 36. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 37. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A. Falsely high fats in the patient's diet. Option B. High concentrations of bilirubin in the serum or plasma sample. Option C. Excessive destruction of red cells inside the tube due to rough handling. Option D. Utilizing the wrong color top tube during collection. The correct answer is option B. High concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 38. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A. A standard eye wash station. Option B. A safety drench shower. Option C. A fire blanket wrap. Option D. An isolation gown station. The correct answer is option B. A safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 39. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A fasting glucose of 90 mg/dl. Option B, a potassium level of 2.1 mg/L. Option C, a total cholesterol level of 210 mg/dl. Option D, a white blood cell count of 7,500/mcl. The correct answer is option B, a potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 40. What type of specimen is used for a Guaric smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A Guaric smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 41. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A, droplet transmission. Option B, contact transmission. Option C, airborne transmission. Option D, vector-borne transmission. The correct answer is option C, airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 42. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 43. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B, place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 44. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyant whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 45. Which of the following represents an occupational exposure route for a blood-borne pathogen? Option A, blood splashing into a phlebotomist's eyes. Option B, touching an intact skin surface with clean hands. Option C, inhaling air in a well-ventilated laboratory room. Option D, spilling saline solution onto a lab bench. The correct answer is option A, blood splashing into a phlebotomist's eyes. Blood splashing into the eyes is an occupational exposure because mucous membranes can transmit blood-borne pathogens. Eye protection is used when splash risk exists to prevent this route of exposure. Contact with intact skin or clean surfaces does not carry the same exposure risk. Question 46. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 47. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A, it causes severe tissue tearing upon skin entry. Option B, it carries an extremely high risk of causing hemolysis in the sample. Option C, it penetrates too deeply into the basilic structures. Option D, vacuum tubes will lose their suction pressure entirely. The correct answer is option B, it carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 48. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A, activated partial thromboplastin time, APTT. Option B, bleeding time test. Option C, prothrombin time / international normalized ratio, patient / INR. Option D, complete blood count, CBC. The correct answer is option C, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 49. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 50. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 51. What should a phlebotomist use to clean a workspace surface that has been contaminated by a blood spill? Option A, 70% isopropyl alcohol. Option B, a 1:10 dilution of sodium hypochlorite, bleach. Option C, plain warm soap and water. Option D, concentrated chlorhexidine solution. The correct answer is option B, a 1:10 dilution of sodium hypochlorite, bleach. Blood spills should be disinfected with an appropriate bleach dilution or approved hospital disinfectant. A 110 sodium hypochlorite solution is commonly used because it inactivates many blood-borne pathogens. Soap and water alone remove soil but do not provide adequate disinfection for a blood spill. Question 52. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A. Miscalibrating a chemistry analyzer machine. Option B. Misidentifying a patient before collecting their sample. Option C. Misinterpreting a reading on a microscopic smear sheet. Option D. Delays in transmitting finalized electronic reports to the doctor. The correct answer is option B. Misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 53. If a phlebotomist needs to collect blood from an infant via venipuncture, what is the preferred needle choice? Option A 21-gauge standard multisample needle. Option B, an 18-gauge hypodermic needle. Option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Option D, a large bore trocar needle. The correct answer is option C, a 23-gauge or 25-gauge winged infusion set, butterfly. Infant venipuncture requires a small, controlled device to reduce vessel trauma. A 23 or 25-gauge winged infusion set allows better stability and visualization in small veins. Large bore needles increase injury risk and are not appropriate for fragile pediatric veins. Question 54. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A, polycythemia. Option B, anemia. Option C, leukemia. Option D, leukopenia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 55. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 56. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 57. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 58. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 59. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A, drawing blood from a patient who has explicitly refused the procedure. Option B, making a minor clerical error on a specimen tube label. Option C, forgetting to wash hands between routine patient encounters. Option D, accidentally causing a small hematoma during an authorized draw. The correct answer is option A, drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 60. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A, shaking the tube vigorously up and down 10 times. Option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 61. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 62. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 63. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 64. What is the function of the thixotropic gel inside a plasma separator tube, PSD? Option A, to accelerate the activation of the coagulation cascade. Option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. Option C, to preserve the concentration of glucose molecules for 24 hours. Option D, to bind heavy metals and trace elements within the sample. The correct answer is option B, to form a physical separation barrier between the cells and the plasma layer during centrifugation. The gel in a plasma separator tube forms a physical barrier between plasma and cells during centrifugation. This reduces ongoing cellular metabolism and analyte exchange after separation. The anticoagulant in the tube is lithium heparin, not the gel itself. Question 65. What is the standard gauge size of a needle used for routine adult venipuncture in most clinical settings? Option A, 18 gauge. Option B, 21 gauge. Option C, 25 gauge. Option D, 16 gauge. The correct answer is option B, 21 gauge. A 21 gauge needle is commonly used for routine adult venipuncture because it balances adequate flow with acceptable patient comfort. It is large enough to reduce hemolysis risk in normal veins. Smaller gauges may be used for fragile or small veins, but they are not the routine default. Question 66. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 67. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 68. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 69. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 70. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A, 70% isopropyl alcohol prep pads. Option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C, tincture of iodine solution. Option D, concentrated hydrogen peroxide spray. The correct answer is option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 71. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A, the dorsal aspect of the wrist. Option B, The dorsal aspect of the hand. Option C. The anterior aspect of the foot. Option D. The saphenous vein in the ankle. The correct answer is option B. The dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 72. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A. Check the site to confirm that active bleeding has completely stopped. Option B. Ask the patient to bend their elbow firmly over the gauze pad. Option C. Apply a generous layer of antibiotic ointment to the wound. Option D. Label the tubes using the patient's bedside charts. The correct answer is option A. Check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 73. For which of the following tests must the specimen be protected from light immediately after collection? Option A. Ammonia. Option B. Bilirubin. Option C. Lactic acid. Option D. Prothrombin. The correct answer is option B. Bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 74. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 75. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A. The exact center of the finger pad on the index finger. Option B. The fleshy, off-center side of the distal segment of the middle or ring finger. Option C. The side of the pinky finger close to the nail bed. Option D. The palmar crease of the thumb. The correct answer is option B. The fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 76. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 77. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option F 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B, 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 78. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 79. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU. Collection. Option A, layering multiple drops of blood onto a single filter paper circle. Option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Option C, using a capillary tube to collect blood and then smearing it across the card. Option D, wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 80. Which of the following structures is an example of an unoxygenated blood carrier? Option A, pulmonary vein. Option B, aorta. Option C, superior vena cava. Option D, brachial artery. The correct answer is option C, superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 81. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A, use the tube anyway if it is the only one available on the tray. Option B, discard the expired tube and select a current, unexpired tube from inventory. Option C, assume the additive inside is still functional for another 6 months. Option D, write the current date over the expiration date on the label. The correct answer is option B, discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 82. What type of mask is required when entering a room designated for droplet precautions? Option A certified N95 respirator mask. Option B, a standard fluid-resistant surgical mask. Option C, a cloth face covering or scarf. Option D, no mask is required if you stay 2 feet away from the bed. The correct answer is option B, a standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 83. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count. CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 84. What color tube top indicates that the tube contains the additive sodium heparin? Option of light blue. Option B, dark green. Option C, lavender. Option D, light green. The correct answer is option B, dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 85. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 86. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option of leukocytosis. Option B, leukoponia. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukoponia. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 87. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A, serum layer. Option B, Buffy coat. Option C, fibrin web. Option D, thrombotome. The correct answer is option B, Buffy coat. The Buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 88. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 89. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, gray top. Option D, green top. The correct answer is option C, gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 90. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1C. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 91. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option of light blue, blood culture, lavender. Option B, blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 92. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option of voiding directly into the cup without any prior cleaning steps. Option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C, saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D, restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 93. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 94. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A, CDC. Option B, FDA. Option C, OSHA. Option D, CLSI. The correct answer is option C, OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 95. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 96. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A, the posterior curvature of the heel directly over the calcaneus bone. Option B, the medial or lateral margins of the plantar surface of the heel. Option C, the central arch area of the foot pad. Option D, the tips of the smaller toes. The correct answer is option B, The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 97. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A. Enlist colleagues to restrain the patient by force without nursing guidance. Option B. Postpone the draw and consult with the nurse in charge of the patient's care. Option C. Attempt to draw blood while the patient is asleep. Option D. Cancel the test order permanently on your own authority. The correct answer is option B. Postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 98. What should a phlebotomist do if they note that an inpatient's identification band is attached to the bed rail instead of the patient's body? Option A. Scan the band on the bed rail and proceed with the draw. Option B. Refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. Option C. Ask the patient's visitor to confirm that the band belongs to the patient. Option D. Cross out the name on the band and write it on a new tube label. The correct answer is option B. Refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. An ID band attached to the bed rail does not reliably identify the patient. The phlebotomist should not collect until nursing staff verifies identity and attaches a proper band to the patient. Scanning or using a detached band creates a wrong patient risk. Question 99. Why is a royal blue top tube used for trace element and toxicology testing? Option A. The tube contains a unique fast-acting liquid anticoagulant. Option B. The tube stoppers are specially manufactured to be free of trace element contamination. Option C. The tube is thicker to resist breaking in specialized centrifuges. Option D. The tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 100. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A. Hematology. Option B. Microbiology. Option C. Clinical chemistry. Option D. Blood bank. The correct answer is option C. Clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing.